This is Samantha Jellison of Securely Insured, and this is Medicare on the Mind. Today we're going to talk a little bit about the importance of considering something called ancillary plans. So while Medicare would be your primary health insurance between Medicare, Original Medicare, or Medicare Advantage, or a Medicare supplement, because those are your three main options, sometimes those don't provide the exact coverage that you might require. And it's a good opportunity to discuss something that we call ancillary plans. With ancillary plans, the idea is that you're purchasing extended coverage. For instance, it's recommended with a Medicare supplement plan to purchase a standalone dental, vision, and hearing plan, because that's not included in a Medicare supplement plan. That would be something that you could bundle at the time that you are purchasing your Medicare supplement plan. Now, you might wonder why you would need additional dental, hearing, and vision coverage if you have a Medicare Advantage plan. Well, you may and you may not. Where most of these plans, Medicare Advantage plans, do have some level of coverage for these additional benefits, they are not the most all-inclusive. They can have restrictions on the amounts that they provide coverage for. So if you were in need of extensive dental coverage, it might be worth considering looking into a standalone dental or a standalone dental, vision, and hearing plan. In addition to what we call DVH plans, there is something called a HIP plan, or otherwise known as a hospital indemnity plan. The thing about hospital indemnity plans is I find them very useful for people that are on Medicare Advantage plans, because if you were to have a poor health year and anticipate having to go into the hospital, let's say for 4 or 5 days, it's not outside the realm of possibility. These plans help to reimburse you for that higher copay that you're going to pay for typically days 1 through 6. And one thing to note too is that copayment for days 1 through 6, that is not per year, that is per benefit period. Therefore, to make that easier to understand, if you were to go into the hospital for an extended stay, let's say 10 days, in January, most Medicare Advantage plans are going to have a copayment of about, it could range anywhere from $300 to $500, could be a little bit more, per day for the days 1 through 6, and that's what it usually is, days 1 through 6. Some plans will be days 1 through 5, but just for the sake of simplicity, we'll just say days 1 through 6, because that's pretty standard. So therefore, if you're in the hospital for 10 days in January, you are paying, let's say the copayment is $465 per day for days 1 through 6. So you've now you'll now be billed close to $2,000 to $2,500 for your stay in the hospital. When I say benefit period, that means if sometime in April, because benefit periods for hospital stays are typically 60 days, sometime in April you have to go back to the hospital, that starts over again. So that means that you might end up paying that $2,000 to $2,500 copayment for your first hospital stay, get out of the hospital, then end up going back in a few months later, and if you are once again there for beyond 5 or 6 days, you will have that copayment once again. So what a hospital indemnity plan is, that is a plan that will reimburse you. You can choose how many days you want your effective period to cover, and you can choose the amount that you want to be reimbursed per day. Essentially, one way of looking at it is the plan, you are paying a monthly premium for it. It will basically pay you for staying in the hospital. Most people, when they elect for a hospital indemnity plan, they look at their Medicare Advantage plan and they say, okay, so I'm responsible for days 1 through 6. My copayment is $465 for those first 6 days. I want to have a hospital indemnity plan that at least covers that. And you can usually find a hospital indemnity plan for a pretty low monthly payment. And I think for the most part, it's pretty beneficial to have that in conjunction if you anticipate having a tough medical year ahead. If you're on the younger, healthier side, it's not necessary per se, but I don't think it's something that you shouldn't at least consider when you're choosing your Medicare plan. And then finally, one other ancillary plan we're going to talk a little bit about is what is known as a cancer, heart attack, and stroke policy. This is also known as a critical illness policy. This can be very beneficial if you have a history of cancer, heart attacks, or strokes in your family. It's more beneficial to get this type of policy, this type of plan before you have any of these issues, because it is a policy that you have to undergo underwriting. And for the most part, what this plan does is if you are diagnosed with one of the covered critical illnesses that are mentioned in the policy, it will pay you out in a lump sum. And you can utilize that lump sum in a wide range of ways. You can use it for covering your medical expenses, your travel expenses if you have to go to a specialty hospital out of state for cancer treatment. You can use it as a source of income if you lose income because you're sick. And while most people don't enjoy having the added cost per month, it is something to consider. You should be speaking to your broker, your agent about it, because it's one of those things that it's better to have and not need it than to need it and not have it. And that's pretty much it with ancillary benefits. We can certainly discuss each of them in more detail, but for the most part, not many people are made aware of these when they're signing up for their Medicare plan. And I think that's a shame, because you should know what all your options are and how to offset some really expensive medical costs. And that is about it. And again, my name is Samantha Jellison of Securely Insured, and this is Medicare on the Mind. Stay tuned for our next episode, and I look forward to seeing you then.